So let's talk about falls. You've probably seen the commercial of the elderly lady on the floor saying, "Help, I've fallen and I can't get up." Well, falls are a serious thing. As the population is getting older, we need to make sure we prevent this. Why? Because a couple things happen when you fall. Firstly, you might hurt something or break a bone. It costs a lot of money. And after you fall, you become more fearful of falling again, and therefore reduce your activity level. This might put you down the road of getting diseases such as obesity, diabetes, and heart disease. There is a quick test that you can do as you're getting older, yourself, or if you know somebody. It's called the Timed Up and Go test, or the TUG. All you need is a timer and a chair with armrests. You mark something that's 10 feet away. You ask the person to stand up, go to the marker, turn around, and sit down. The average time to complete this test is 10 seconds. If you finish it in 14 seconds or more, you're at higher risk of falling. At that point, you should call a doctor or a physical therapist. So let's talk basketball. Celebrities like Derrick Rose tore his ACL and Kobe Bryant tore his Achilles. But people like you and me can also get less severe injuries that'll put us on the sidelines. Basketball involves cutting, explosiveness, and although it's not as intense as football, it is a contact sport. To check the cutting and the explosiveness, you can do a two-legged jump. Look at what happens to your knees. Do they fall in together and touch? That means you don't have control of your lower body. For the explosiveness, you go on your tiptoes as if you're doing a calf raise and see what happens to your ankles. See if they move in or out, or if you feel completely steady. Then you have control of your lower body. The other aspect is fear. So, for example, when you're boxing out, you're gonna get pushed around. You wanna make sure you have control of this, and you also wanna make sure that you're not fearful of it, because that will reduce your performance. So a quick thing that you can do is just stand in place and have somebody push you around. If you fall over, you don't have control. And also if you're timid or you're intimidated, that's a fearful component that will affect your performance. So with these tips, hopefully you can prevent an injury and perform at your best. So now let's talk baseball and softball, specifically batting. Even though when you move the bat, it's with your upper body, okay? It's important to use your lower legs, and we're taught this at a young age when you start playing baseball or softball. So it's not just that you use your lower body, but it's important that you use it correctly. So two things that you can do is you can take a bat in your hand and you balance. On your left side, you balance on your right side. Hold it for a couple seconds. If you find that you're off balance, something is weak in your leg or something's not working properly. The other thing you can do to take it a step forward is that you balance and then you take a swing. Balance on your right and you take a swing. If you notice that you're off balance, take a swing or you're shaking, that's a time when something's not working properly, and that's when you have to find out if a physical therapist can help you find out where the lack of control is coming from. So once you find that control in your lower body, then the next step is just keep your eye on the ball and swing away. So now we're going to talk about walking in a big city. I'm here in New York City where I live and work. If you live in a big city, you're probably going to do a lot of walking, and in addition, you're going to be carrying something, such as I do this gym bag right here. Now remember, if I carry my bag on my right side, it's actually my left hip that's doing all the work. Even if I take the shoulder strap and put it around my head, the weight is on my right, my left side is still doing all the work, and that's what's going to keep me upright. One thing to keep in mind is that you want to make sure that you alternate the weight. So on a Monday, you might put the bag on the right side. On a Tuesday, you put the bag on the left side. So if you're walking around experiencing any pain, you might want to check with a physical therapist to see if a hip is an issue. So remember, the sea is much more enjoyable when you're pain-free.